Thank you for the opportunity to speak to you today. I'm Toshio Inui, CEO of Saisei Mirai Group in Japan. My talk is entitled COVID-19 Clinical Trial MAF, Macrophage Activating Factor and Integrative Approaches to COVID-19 Treatment. My talk starts with an introduction to COVID-19. Currently, the pandemic is still serious throughout the world with variants. But we have hope, and I'll explain the reason for this hope in my presentation today. My second topic is our clinical trial using MAF, Macrophage Activating Factor, for hospitalized COVID-19 patients in the Ukraine. I'll also explain macrophages and Macrophage Activating Factor, called MAF for short. Specifically, I will be talking about GcMAF, Colostrum MAF, and Whey MAF. After that, I'll talk to you about outpatient COVID-19 treatments, as well as bats. Why bats? Bats have some very important secrets that we should learn about. Introduction to COVID-19. Many people already know about COVID-19. COVID-19 is an infectious respiratory disease caused by a novel coronavirus named Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2, that emerged in Wuhan, China at the end of 2019, resulting in a worldwide pandemic. One of the big problems is that COVID-19 can progress to severe acute respiratory syndrome with pneumonia and acute respiratory distress syndrome, ARDS. The other big problem is that the gene encoding SARS-CoV-2 spike protein continues to undergo mutations. So, SARS-CoV-2 continues to mutate. The mutations occur regularly during the viral replicative cycle. Most of the changes in humans do not give a selective advantage. This means that they usually don't end up replacing the pre-existing lineage. However, genetic variants of SARS-CoV-2 have been emerging and circulating around the world throughout the COVID-19 pandemic. This article was published in the journal Cell last year. As you can see, a SARS-CoV-2 variant with the spike protein G614 mutated from the original D614 and became the dominant pandemic form of the virus. The consistent increase of G614 at regional levels may indicate a fitness advantage, and now there are many variants emerging worldwide. 4 major variants of concern have been identified based on where they were first described. B.1.1.7 was first identified in the UK, B.1.351 in South Africa, P.1 in Brazil, and the Indian variant, now widely called the Delta variant, in India. The triple mutant variant, also being referred to as the Bengal strain, is reportedly more infectious than the other strains. These variants are no longer limited to the countries in which they were first identified. Recent variants of concern seem to result in increased disease severity, increased transmissibility, and evading the immune response. More recently, the focus has been on the possibility that these variants of concern may evade the immune response. However, the clinical fact that asymptomatic infection always occurs may suggest that our immune system, cellular immunity, and antibodies may deal with even triple mutants. Spike protein causes cell damage. The novel coronavirus spike protein plays an additional key role in illness. This is a very serious problem, and many people have asked me for the reasons why and how. This figure shows the effect of spike protein on mitochondrial structure in vascular endothelial cells. Mitochondria play a pivotal role in cellular energy production. It is also known that mitochondria control innate immunity and cell death. As you can see, the mitochondrial structure of control cells in the left panel is elongated, while the structure of the SARS-CoV-2 spike protein treated cells in the right panel is fragmented. These results indicate that SARS-CoV-2 spike protein induces mitochondrial damage. Scientists have known that SARS-CoV-2's distinctive spike proteins help the virus infect its host by latching onto healthy cells. Now, a major new study shows that the virus spike proteins play a key role in the disease itself. The paper, published on April 30th, 2021 in Circulation Research, also shows conclusively that COVID-19 is a vascular disease, demonstrating exactly how the SARS-CoV-2 virus damages and attacks the vascular system on a cellular level. The findings help explain COVID-19's wide variety of seemingly unconnected complications and could open the door for more effective therapies. This NIH figure shows the prime cellular targets for SARS-CoV-2. This is important, and later I'll explain the relationship between the prime cellular targets for SARS-CoV-2 and MALT, mucosa-associated lymphoid tissue. Now I'm going to talk about the clinical trial of the MAF capsules used for hospitalized COVID-19 patients in the Ukraine. The clinical trial in the Ukraine is a phase 2 clinical trial to evaluate the efficacy of Colostrum MAF and Whey MAF compared to the control group. 300 patients have been enrolled in this clinical trial and are randomized into 3 groups: SOC, standard of care, SOC plus Colostrum MAF capsules, and SOC plus Whey MAF capsules. We have not yet finished this clinical trial, but in the next slide I'm going to talk to you about the results we've had so far. We have almost finished treating around 200 patients in this trial, and I'm going to summarize the preliminary results of the clinical study. The main points of the results are no adverse events, a decrease in the mortality rate, decrease in necessity and duration of supplemental oxygen, decrease in time to recovery, decrease in time until hospital discharge, prevention of respiratory failure, and restoring the baseline decreased lymphocytes count. We are going to update the results of the clinical study as soon as possible once they become available. I'm now going to talk about post-COVID syndrome and our ongoing clinical trial of MAF capsules for patients with post-COVID syndrome. What is post-COVID syndrome? The timeline of post-acute COVID-19 is shown in the picture. Acute COVID-19 usually lasts up to 4 weeks from the onset of symptoms. Post-acute COVID-19 is defined as persistent symptoms and/or delayed or long-term complications beyond 4 weeks from the onset of symptoms. The common symptoms observed in post-acute COVID-19 are summarized in the picture, and I'll talk more about the symptoms on the next slide. While the definition of the post-acute COVID-19 timeline is evolving, based on recent literature, it is further divided into 2 categories. 1. Subacute or ongoing symptomatic COVID-19, which includes symptoms and abnormalities present from 4 to 12 weeks beyond acute COVID-19. And 2. Chronic or post-COVID-19 syndrome, which includes symptoms and abnormalities persisting or present beyond 12 weeks of the onset of acute COVID-19 and not attributable to alternative diagnoses. On the other hand, the CDC calls such symptoms post-COVID conditions and indicates that even people who did not have symptoms when they were infected can have post-COVID conditions. Long COVID is a range of symptoms that can last for weeks or months after first being infected with the virus that causes COVID-19, or can appear weeks after infection. Long COVID can happen to anyone who has had COVID-19, even if the illness was mild or they had no symptoms. People with long COVID report experiencing different combinations of the following symptoms: fatigue, brain fog, headache, loss of smell or taste, dizziness on standing, heart palpitations, chest pain, shortness of breath, cough, joint or muscle pain, depression, and fever, among other symptoms. Multi-organ effects can affect most, if not all, body systems, including the heart, lung, kidney, skin, and brain functions. Multi-organ effects can also include conditions that occur after COVID-19, like multisystem inflammatory syndrome, also called MIS, and autoimmune conditions. MIS is a condition where different body parts can become swollen. Autoimmune conditions happen when your immune system attacks healthy cells in your body by mistake, causing painful swelling in the affected parts of the body. Post-COVID conditions also can include the longer-term effects of COVID-19 treatment or hospitalization. Effects of COVID-19 treatment and hospitalization can also include post-intensive care syndrome, or PICS, which refers to health effects that remain after a critical illness, These effects can include severe weakness and post-traumatic stress disorder, or PTSD. On this slide, I'll talk a little bit about tissue macrophages. Tissue macrophages are very important in post-COVID syndrome. Why? Many people have asked me about this, so I'll explain the reasons. First, tissue macrophages include tissue-resident macrophages and monocytes originally circulating in the blood. Second, macrophages exist in nearly all tissues throughout the body, fighting against pathogens, including SARS-CoV-2. Third, and most importantly, tissue-resident macrophages play critical roles in the repair, regeneration, and rejuvenation of damaged or even normal tissue. We have started clinical trials in Kazakhstan on the base of the National Research Cardiac Surgery Center of Kazakhstan. The study is called Evaluation of Immune Modulator MAF Capsules Efficacy in the Therapy of Patients with Post-COVID Syndrome. It aims to evaluate the safety and efficacy of the MAF capsules dietary supplement with the anti-inflammatory immune response modulating function in combined treatment of the post-COVID syndrome. The trial started in February 2021 and targets 200 patients with post-COVID syndrome, which were randomized in 2 groups equally. Group 1 receives standard of care only, and Group 2 receives standard of care plus MAF capsules for 30 days. The study of primary endpoints aims to evaluate the improvement within a 30-day period after the MAF capsules are administered, where the clinical efficacy refers to an improvement of life quality according to the Chalder Fatigue Scale and the post-COVID syndrome consequences and symptoms severity evaluation according to the ISARIC questionnaire. The study of secondary endpoints includes the evaluation of changes according to the Karnofsky Performance Scale and Numerical Rating Scale, and evaluation of MAF capsule side effects. The results of the study are under final analysis and due to be published soon on our website. Now I'm going to introduce macrophages to you. So, what are macrophages and why are they so important against COVID-19? Let's take another look at the prime cellular targets for SARS-CoV-2. When you look at this figure, what does it make you think of, or what might you imagine from it? For me, this figure brings to mind the mucosa-associated lymphoid tissue, MALT. This is because lots of immune cells are ready in these places against COVID-19. Cellular immunity is of course very important against COVID-19, as are natural and vaccinal antibodies. So what is MALT? The MALT, mucosa-associated lymphoid tissue, constitutes the most extensive part of the human lymphoid tissue. The components of MALT are subdivided into GALT, gut-associated lymphoid tissue, BALT, bronchus-associated lymphoid tissue, and NALT, nasopharynx-associated lymphoid tissue, among others. These constitute the largest macrophage pools in the body. What this means is that the macrophage should not be in a sleeping mode. Rather, it should be in a primed, activated state, such as what you would find in healthy young people. The MALT, mucosa-associated lymphoid tissue, includes huge numbers of macrophages and dendritic cells, as well as T lymphocytes and B lymphocytes. Macrophage Activating Factor, MAF, is aimed at directly activating the huge numbers of macrophages, switching them from a sleeping mode to a normally activated mode at these sites. As the COVID-19 pandemic unfolds, pneumonia has become a leading cause of worldwide death and will likely remain so for some time. Advanced age is the biggest risk factor for severe disease or death in patients with viral pneumonia, including COVID-19. Because alveolar macrophages play a critical role in the response to pathogenic viruses and bacteria that cause pneumonia, including SARS-CoV-2, reductions in alveolar macrophage numbers or function during aging might underlie some of the enhanced susceptibility of the elderly to pneumonia. Strategies targeting the aging alveolar macrophages will therefore be very important to restore their function in aging. There are many questions regarding COVID-19. For example, why does asymptomatic infection occur? What are the key cells against COVID-19? What are the key substances to enhance immune function? How can we activate the key cells? The alveolar macrophage stands as the guardian of the alveolar blood interface, serving as the front line of cellular defense against respiratory pathogens. Alveolar macrophages are the primary phagocytes of the innate immune system, clearing the air spaces of infectious, toxic, or allergic particles that have evaded the mechanical defenses of the respiratory tract, such as the nasal passages, the glottis, and the mucociliary transport system. The image people have of macrophages is that of hungry white blood cells which engulf bacteria and other pathogens, moving like amoebas. Macrophages are very dynamic cells and found in essentially all tissues. Many people have asked me what I think about M1 and M2 macrophages. In my opinion, M1 and M2 macrophage theory sounds good, but it doesn't match the clinical facts very well. Until 2000, macrophages had been classified into M1 and M2 macrophages. In 2004, macrophages were classified into 4 types: M1, M2A, M2B, and M2C. In 2014, macrophages were classified into 7 types, and then later there were more types added. According to Professor Hori of Tokushima University, it isn't possible to classify macrophages into only M1 and M2 types because macrophages are moving like amoebas, having more than 1,000 antigens on their cell surface. Recent studies have revealed that the M1-M2 paradigm is not sufficient to encompass all the states of macrophage activation. Macrophages have the ability to change their polarization in response to different stimuli. Macrophage phenotype changes during tissue repair, switching from pro-inflammatory phenotype, M1-like, to an anti-inflammatory phenotype, M2-like. This is simply amazing. Different polarization and activation markers of M1 and M2-like macrophages can coexist in tissues. Polarized M1 or M2-like macrophages, driven by cytokines, can be subsequently repolarized to another phenotype with little or no memory of polarization history. In this video, you can see how macrophages engulf foreign substances using their cell membrane like hands, like this. This is a macrophage engulfing small magnetic beads, and here you can see how a macrophage is extending its membrane to catch a bead. This is called lamellipodia. Once again, in this diagram, you can see how macrophages exist in nearly all tissues throughout the body, such as the brain, the skin, the lungs, and the gut. I'd like to emphasize how important tissue-resident macrophages are in terms of tissue repair, regeneration, and rejuvenation of damaged or even normal tissue. One concept is that macrophages can be found in 3 states: triggered, primed, and aged or stressed state. GcMAF therapy is believed to maintain macrophages in a primed, activated state, ready to combat pathogens without producing high levels of cytokines or inflammation. I'm now going to introduce you to GcMAF. So, what is GcMAF? What is Colostrum MAF? And what is Whey MAF? GcMAF is GC protein-derived macrophage activating factor. I'll explain a little bit about macrophages and the different types of GcMAF. In particular, second generation GcMAF, exciting new Colostrum MAF, and Whey MAF. And I'd like to report that we have succeeded in producing recombinant MAF in Japan. My hypothesis of GcMAF and oral MAF is that they could increase the number of young stem cells of macrophages in the blood and tissues, and they could work for rejuvenation of each tissue, having young and active innate cellular immunity. Here I'll show you 2 videos. The first video shows the control group. Macrophages are just passing by around the beads. The second video shows the group activated by new serum MAF. This is a macrophage, and these are small magnetic beads. These pictures were taken by Professor Nishikata of Konan University using a scanning electron microscope. In this picture, compared with the control group, you can see how a macrophage is ruffling its membrane. This macrophage is activated by our new serum MAF. This is a macrophage activated by GcMAF. The green color shows actin. As you can see, lamellipodia formation and actin accumulation were observed just 5 minutes after activation by GcMAF, and over time these changes grew in strength. Macrophages are also known to play a critical role in anti-tumor immunity. They can infiltrate into tumors and are found in most tumor sites. Generally, it is considered that GcMAF increases phagocytic activity, superoxide radical generation, and has anti-angiogenic and anti-tumor effects. We have also observed that GcMAF increases the number of monocytes in the blood and increases the rate of maturation of dendritic cells in vitro, according to the experiments done by Dr. Kubo at Saisei Mirai. This experiment was conducted by Dr. Uto at Tokushima University. Colostrum MAF strongly activated phagocytosis of gut macrophages of mice. It induces almost the same level of potent activation as lipopolysaccharide. This means GcMAF made from colostrum is very well suited to the activation of macrophages in the mammalian gut. IL-1 beta and TNF-alpha are major inflammatory cytokines associated with autoimmune diseases. Our colostrum MAF does not result in the production of these pro-inflammatory cytokines. This next experiment was conducted by my colleague, Dr. Osaki at Tottori University. In this preliminary experiment, colostrum MAF induced elevated levels of helper T cells and killer T cells in healthy dogs. In this further preliminary experiment, colostrum MAF suppressed the production of IL-4 and IL-6. These Th2 cytokines are typically associated with allergic diseases. Clinical facts support that colostrum MAF and Whey MAF are very effective for allergic diseases, such as pollinosis and atopic dermatitis. The next topic is, how can we treat COVID-19 outpatients? Early detection and early treatment is the gold standard in the medical world. Especially, early treatment for COVID-19 is very important to improve prognosis, ideally while outpatients are still in their home. Now let's look at a strategy for COVID-19. For prevention, vaccination and having active and young cellular immunity are very important. For treatment, I recommend several of the treatments shown in the slide. Standard of care, oral MAF, macrophage activating factor, and/or GcMAF injection, high-dose vitamin C injection, and ozone therapy. Why do we need outpatient COVID-19 treatment? As shown in the slide, the goals of ideal outpatient treatment are to reduce symptom duration, decrease risk of severe disease and hospitalization, reduce infectivity, and reduce likelihood of long-term complications. For those purposes, early administration of oral medication and injection are reasonable and convenient as long as there are almost no side effects. If you get infected with COVID-19, what would you do? Would you simply wait in your house or in a hotel room until your symptoms get better or worse? Early detection and early treatment are important keys in all diseases. We offer apartment rooms to take care of COVID-19 patients with various medications and, of course, oxygen. We have nurses at our clinics who can go to the apartment rooms so that patients can easily take combined treatments and spend time more relaxed, reducing the risk of spreading illness. Once again, early diagnosis and early treatment are important keys in all diseases. Now I'm going to talk about bats, especially their remarkable longevity. Why can bats live so long? Let's take a look at their secrets. Some people love bats, but I guess many people don't like bats as much. One reason is that there have been horror movies and novels about Count Dracula and also vampire bats. In reality, bats are unique, cute, and amazing mammals, so it's a good idea to learn more about them. Introduction to bats. The pandemic brought huge attention to bats. The reason for this is because bats are special. I'll explain why in the next couple of slides. What makes bats special might not be their antiviral ability, but rather their anti-disease features. Infected bats show no or minimal signs of disease, even when high viral titers are detected in their tissue or sera. Longevity in bats and humans. The evolutionary theory of aging predicts that lifespan should decrease in response to the amount of mortality caused by extrinsic sources. Longevity is often correlated to body size. For example, an African elephant can live as long as 70 years. A common house mouse typically lives only 1 to 3 years. Humans are considered relatively long-lived animals, tending to live about 4 times longer than most other mammals when adjusted for size. Bats can far exceed that. Some species can live 40 years, 8 times longer than similarly sized mammals, which is why scientists have long sought to understand bats as a model for healthy aging. If we lived as long as bats, adjusted for size, we could live 240 years. Hibernation is a natural example of caloric restriction. Thermoregulation is very special. One lineage with extreme longevity that does not hibernate but exhibits flexible thermoregulation is the common vampire bat. The bat's amazing ability is to allow their body temperature to fluctuate. For example, the vampire bat can let its body temperature rise and fall throughout the day. The ability to tolerate a wide range of body temperatures could be most important for surviving viral or other pathogen infections. This ability to tolerate a wide range of body temperatures happens to a limited extent in humans. When the immune system attempts to kill a virus or bacterial infection by raising body temperature and causing a fever, it's a natural defense for humans against pathogens. There are some more special abilities in bats, like enhanced autophagy, very high levels of heat shock proteins, reduced production of reactive oxygen species, and reduced NLRP3-mediated inflammatory responses. This figure compares humans with bats in multi-level mechanisms of dampened inflammasome activation. Compared to humans, bats amazingly have dampened transcriptional priming and reduced protein function for NLRP3, loss of PYHIN, including AIM2, and reduced caspase-1 activity and or IL-1 beta cleavage, which leads to an overall reduction in inflammation. What can we learn from bats? Hibernation is not possible for humans, so instead, I recommend some degrees of caloric restriction, such as eating less sugar, eating less junk food, and going organic. Thermoregulation. You can take hypothermia in your house every day. And what I mean by that is taking a hot bath at around 40 degrees Celsius for more than 20 minutes and doing exercise and drinking water. Bats eat either insects or fruits or blood, depending on each species. Food doesn't matter for the longevity of bats. Why? Actually, we don't really know the answer yet. Reduced production of reactive oxygen species. For humans, I recommend eating antioxidant-rich phytochemicals from food sources. Can we all become Batman or Batwoman? This is a very important question to me, and my answer would be partially yes. Next year, I'll be able to tell you the reason why after I get back the experiment results that we are doing now in Japan. In the meantime, thank you very much for your attention today, and please feel free to contact us at any time through the information you can see on the screen.